Hi, everyone. Thank you both for joining. We'll just give everyone a minute or two to join, and then we'll kick off in a second. It won't be long. Awesome. Well, we'll kick off now, and then hopefully some more people will join us in a second. So yeah, good afternoon, everyone. Thank you for joining today. This is going to be a session all about recruit to help support practices to participate in some upcoming clinical research studies that are going to be launching in your area. And we're also going to be hearing about an exciting opportunity that has been brought to you by Sanofi today. So myself and my colleague Amal, who are from the Research and Life Sciences team here at Optum UK, we're going to kick off by introducing you to Recruit and inform you how you can activate it for free today in your systems. In fact, stay tuned for the end because we will be also announcing a competition for practices who activate. There's an opportunity to win an espresso machine there, so stay tuned for the end. And then we're also pleased to have Priya with us here today, who's one of the clinical operations study leads at Sanofi, who's going to be describing to you a brilliant opportunity that's going to be coming up for the AIRLYMPUS study. And this is currently recruiting in London, Bradford, Barnsley, Nottingham, Corby, and Oxford, and we'll be going live and recruit very soon. So if you have any questions, please plop these in the Q&A function, and members of the team who are on the chat here will be keeping an eye on and happy to answer them. And we'll go from there. So I'll hand over to you, Amal, then. I think you're going to kick off the slides. Thank you.
Thanks, Izzy. Hi, everyone. Right, so let's talk about the opportunities we have for primary care in clinical trials. So primary care providers are in a unique position to help transform how we approach for clinical trial recruitment. And why is this? So firstly, we're unique here in the UK to have the rich coded cradle to grave data. So that means you can quickly identify patients who may be eligible for certain trials, and you hold that control of those patients. Secondly, patients, of course, have that trust with their primary care provider, so their GPs, and that trust gives you the ability to offer patients more meaningful opportunities and the likelihood that they would take part in research. Thirdly, the diverse participation we have across the whole nation, so the whole of the UK. And finally, we're working to make this process as simple as possible. So you'll see when Izzy presents the tool that it's an integrated tool within your EMIS system, quick to use, and not only help advance the research, but also generate the additional money. And who doesn't want those extra pounds? So really, primary care isn't just a participant in clinical research, but it's a driver of getting those patients into the trials. So recently, thanks, Georgia, we contributed to the new market strategy report. Full title of this report is basically Harnessing Primary Care Data for Clinical Research, and you can use the QR code to have a flick through this report. But some key stats we had from this report. So 81% of healthcare professionals that were surveyed agreed that primary care definitely has an integral role in providing patients the opportunity to participate in research. And 68% of these professionals, healthcare professionals, said that they would be more likely to engage if there was something embedded within their clinical system. 87% of patients that were surveyed agreed that it's very important for the NHS to conduct research, but they lack awareness of how to participate. And 93% of these patients said that they would be likely to participate if they received a text message from their GP. So again, the trust element here plays a really big part. So I'm going to hand you over to Izzy, who's basically going to do a deep dive of what Recruit is and how it all works.
Well, thanks, Amal. Yeah, so this is why we've developed Recruit as a solution. It's embedded into your clinical system, and it's going to be easily enable you to support clinical research opportunities as part of your busy working day. At the moment, we have just over 1,200 of our practices who use EMIS are using Recruit to date, and that number is increasing every day as we have more studies that come onto the platform. And we've designed the solution to take essentially all the hard work of building the manual searches, reviewing long patient lists off your hands. So what we do is we utilize the primary care record, and we have a brilliant team of clinical informaticians here at Optum, And we work with sponsors to build those complex searches matched to the clinical trial protocol to determine whether someone in your practice has a good chance of being eligible for that study criteria. We then embed that search into your EMIS-X system, and that enables you to easily identify which patients from your practice would be most eligible to take part in that study opportunity. Within the tool, then we've also enabled some SMS and emails to be sent to those patients that you wish to share the opportunity with. And that easily allows you to connect with those patients without having to send any existing SMS, use any of your existing SMS quotas or sending manual letters. As you'll see in a moment, this process is all done within a few clicks. So it's super accessible for you and makes it really easy for your practice to take part in these opportunities, but also provide the patients across the community with opportunities to take part in important research that they may never have come into contact before and might be beneficial to their own health. We are continually improving and streamlining the recruitment process, both for GPs and for the study sites. And we've recently added to the ability to securely share healthcare records with patient and GP consent direct to the research sites. And that's to enable the patient screening processes that take place by the study team. And this has removed a huge need for any manual delay that might come in with those requests that go to GPs. They need to review patient records, send manually over an extraction to that centre. And it's also helping to that site to sort of support that site efficiency and reducing the workload, not only for you, but the site the other end. We recently actually did this for a study in the platform, and we had some really great data that came back. I think, in fact, 85% of patients that were invited to that study consented to their healthcare record to be shared, and with the GPs, they essentially shared those healthcare records with the study site within 24 hours. So that's the sort of turnaround and, the efficiencies we're seeing. We also have the ability at the moment to schedule appointments in as well. I don't think we're going to be using that for this study, but again, part of that patient journey, we're able to enable that patient to go and select appointments off the back, so we can get patients in as soon as possible. So next slide, please. Thank you. And here in Optum, we just want to ensure that all the clinical safety and patient outcomes are, of course, our top priority. And as we continue to develop Recruit, we do so with our GPs, our sponsors, sites, and patients in mind to drive those opportunities that come through. And just to make you aware, all the trials that you'll see featured in Recruit, these all have been approved by HRA before being published. And they also must go through quite a robust internal process here with our review groups to ensure that they are suitable for the platform and will also bring patient benefit. Next slide, please. So yeah, why should your practice activate Recruit today and start getting involved? Well, we've made this completely free for your practice to use and without the need to log into any other system. It's all completely done within your own EMIS clinical systems. What we have done, we've set up what's called our GP terms and conditions at the start of the product, which you'll review. And these cover all what is called PIC agreements that are required for any studies who are presented in Recruit. And it just ensures that all the right data sharing agreements are in place. As we mentioned earlier, we've also done all that hard work for you. So once you've accepted the terms and conditions, you'll see hopefully some studies in there, and hopefully today you'll be able to go in and find out when the AIRLYMPUS study is going to be ready for you. Once you go into that study in a minute, you'll see this all in our demo. We've done all the hard work for you. So those complex searches have already been embedded in the background, and it allows us to precision match those patients to study opportunities, making it super quick and easy for you to review those lists of patients and invite them on. We also have obviously that inbuilt functionality to share healthcare records, and this does so direct to site. So again, no need for any of that manual extraction and sending, reducing the burden and time taken. And finally, like we said, maybe some of the most important bits for your practice. Practices are reimbursed for supporting opportunities. So whether that's for patients who go on to register their interest or for sharing a healthcare record, the Optum will facilitate those payments to your practices on a quarterly basis. And again, it just opens up another revenue avenue for your practice there. So without further ado, I'll click onto the next one, and we've got a little video essentially to show you here about how to activate Recruit and just give you a walkthrough about what it looks like and feels like in there. And this obviously be super helpful for when you are able to go and support the AIRLYMPUS study coming. Yeah, you'll see here, this is what the Recruit platform looks like within your EMIS system. As you see, it's super easy to get through in the population care tab there. And once you're in, you'll be able to see a list of all the studies that will be recruiting in your area. And we give an overview here of the status of that study, how long those studies are going to be open for, but also how many patients in your practice might fit that criteria, and also a flavour of the reimbursement that will come back. So we try to give you here a sort of upfront view of everything you can do. You can go in and also search for studies, and we give you an overview of what that study looks like. So this is where we work with a sponsor to give you information around that study. Then to be able to support a study, we have just a study level T's and C's. This just says, yep, you're happy for us to run that search in the background, and you can start inviting patients. Once you go in there, again, we've produced all this content with the study team, and it's to give you a complete overview of those study details. So again, you'll be able to see what the study means to you, but also what the patient sees, and this is all ethically approved. Again, you'll be able to see any information here, whether there's healthcare record sharing, contactability, or the locations of the study sites will be. And you'll also get to see the search that we have agreed and applied to find those patients with the sponsor. And you'll see here, yeah, we give you sight of all the messaging and information those patients will see when they receive those texts. What you'll be able to do here, we also supply you with permission from the sponsor, access to the protocol, so you can go and have a full read of that study. And then you'll be able to click in the tab and see those list of patients that have all been precision matched to the search criteria. And again, here we make it super easy for you to go through. You can select all, you can select a certain patient, you can exclude people, and you can send those text messages on from there. So again, you can select a text or email, depending on what that patient has, and you'll have a site of email, and we make those personalized. So it'll be, dear so-and-so, this is from Dr. So-and-so. So it will look like it comes from your practice. And there's also the ability to set reminders there. And again, if we have the template in, they can be sent. So that can be all done within the system. And like you say, there we go. Within a few clicks, you've invited patients to that study. So it's super easy for you. You'll also get a status of where those patients are in their journey, whether they have gone on to accept the study and gone on to consent to be contacted. Next, you'll see a bit of a view here about what this means for the study site. So they'll receive then those contact details from the patient, and you'll be able to see about which status those patients are in the process. So whether they've gone on to be screened, etc., etc. We'll also be able to see here about the healthcare record sharing, and this won't actually apply for the AIRLYMPUS study that's going to be presented in a minute, but just to give you a flavour for any other studies that come up. And again, like you say, we've done the hard work for you here. So we present to you an extract of the healthcare record. We allow you to go in and review that. And if you want to press approve, it will automatically send through the share the record with the study site. What we do in the background is we keep the patient informed at every step of the journey. So we let them know when their healthcare record has been shared, just because, again, we want to make sure they're aware of what's going on. There also is the ability in the platform here, if you don't want to send that automated version, you can decline and you can send a manual version as well. And again, we inform the patient of exactly what's happening there. So there is the ability as a GP, if you want to override that, and we do allow that in there. And again, here you go, you can retract it manually. Again, we inform the patient of those steps. Okay, I think they're going to share the record. There we go. And there we go. I just want to say it's super easy for you. You can go in and activate today and start recruiting those patients. So again, I think it was in about 5 or 6 clicks that you can go in and start sending those invitations to patients. Thank you very much, Georgia. We can probably pause it there. Next slide. Right, so last slide here before I pass over to Priya. So yeah, just a little bit of a flavour. Again, just a recap, I think, of why we've done this and some of the success to date. So as we can see here, like I say, we've got just over 1,200 of our practices who are actively using Recruit and inviting patients to studies today, and this is increasing daily. We've had over 16 studies that have been supported for Recruit to date. And as you can see, we've had a really good number of enrolments to the study, and we've actually helped to recruit over 1,000 participants to studies since they've been in Recruit. And we've also won a couple of clinical awards of recent time for our technology. So again, it's something that's super good, and it's sponsors are wanting to use to be able to expand their recruitment and be able to accelerate the trial recruitment process. So without further ado, I will kindly pass you over here to Priya, who's come from Sanofi today to talk to you about the AIRLYMPUS study, and this is going to be the study that will be presented in Recruit. So Priya, over to you. I'll put you on the spotlight as well. There we go. Thank you.
Thank you so much, Izzy. Hi, everyone. Good afternoon. My name is Priya from Sanofi, working on the AIRLYMPUS study as the study country lead, along with the other asthma trials within Sanofi. So here I'm today going to talk about the high-risk asthma, which is the study that we are looking into at the moment. And again, I won't go in very much detail about asthma, as you all might know. Asthma is considered a chronic inflammatory airway disease, and it is considered one of the most common chronic diseases worldwide. And based on the GINA current management approach, it is mainly consisting of the symptomatic disease control and then escalating care accordingly. And if you look at the chart here on the right, you can see that we consider the step 1 to 2 as the mild asthma patients, and then we've got step 3 and 4 based on the GINA guidelines considered as moderate. So in the current study, we are looking at mild to moderate patients where possibly the patients will be taking ICS whenever it's required, or they'll be on a low dose maintenance of ICS along with LAMA. Next slide, please. So our IMP in the study is linsecamig, which is a novel antibody. It's a nanobody molecule, which is delivering a targeted bispecific inhibition of TSLP and interleukin-13 to reduce the pathological inflammation. It is a pentavalent molecule with 2 binding sites for each target, 2 for TSLP and 2 for IL-13. And then we have 1 single binding site, which targets the human serum albumin to increase the half-life. So linsecamig is given as a multi-targeting approach and helped us to improve potency when compared to monotargeting TSLP or IL-13, which is demonstrated in the preclinical models, and which is why we believe if we continue the approach of multi-targeting with linsecamig in the asthma mild to moderate patients, we're going to see better benefits. Next slide, please. So talking about AIRLYMPUS, so this is our trial in study now. It's a randomized phase 2 double-blind, placebo-controlled, parallel group, 2-arm study to investigate the efficacy, safety, and tolerability of subcutaneous linsecamig in adult participants with high-risk asthma who are not currently eligible for any biologic treatment. Slide. Just to give you a schematic representation of what the study looks like. So we've got a 4-week screening period where all the patients potentially eligible for the study will be entering into the screening period, perform the screening assessments. And then we've got 2 parts to the study. So we've got a run-in period of 4 weeks where there'll be no intervention with linsecamig. The patients will go on a maintenance ICS LABA for 4 weeks. And at the end of 4 weeks, they will again be tested on their FeNO and eosinophils. Based on the eligibility criteria required by the protocol, they will then be randomized into the Part B treatment period. The Part B treatment period is with a linsecamig or placebo arm for 52 weeks. So patients can either have 300 micrograms every 4 weeks plus ICS LABA, or a placebo with ICS LABA. And the main criteria is that they have to have a FeNO of over or equivalent to 35 parts per billion to get randomized into the study. After the randomizing period, the treatment period, the patient will enter a follow-up period of 4 weeks where they'll again continue to stay on the ICS LABA. So if you notice, we've got ICS LABA from Part A until the end. So we're trying to say that linsecamig as an add-on is going to benefit the patients in this study. The main objective is to look at the efficacy, safety, and the tolerability of the add-on effect of linsecimig in participants in asthma who are currently not eligible for any biologic treatments. We estimate the study to be completed in November 2027, and we're looking to enroll about 1,000 patients, which is going to be a challenge for the study. Slide, please. So I'll just briefly go through the main inclusion-exclusion criteria. So we're looking at patients aged 18 to 80 years of age, physician diagnosed mild to moderate asthma based on the GINA guidelines with at least one asthma exacerbation in the year prior to their screening visit. They need to have a pre-BD FEV1 of over or equivalent to 40% of the predicted normal at the time of screening, and they need to have evidence of BD reversibility. So the evidence of BD reversibility can be done on the day of screening, or if we've got historic evidence in the medical notes, we can use them as an eligibility criteria. Again, they have to be on a maintenance ICS of less than or equal to 500 micrograms of fluticasone propionate, or less than equal to 800 micrograms a day of budesonide or any other comparable ICS. And some of the key exclusion criteria, again, we looking to exclude other severe lung diseases, which may impair lung function, deterioration of asthma resulting in hospitalization, or any treatment with systemic steroids 1 month prior to screening, upper or lower respiratory tract infection within 4 weeks of screening, or any other known or suspected immunosuppression history. So our primary endpoint is to look at the rate of asthma exacerbations. And again, based on the definition of exacerbations here, we're looking at worsening of asthma, which requires the use of systemic corticosteroids for over 3 days, hospitalization, or any emergency room visits. Next slide. So this is just to give you an overview of where the current study sites are. So we've got, we tried to have a good variation in the sites we've selected. So we've got Queen Anne's in London, Bradford Hospital, Barnsley, Nottingham, Lakeside, John Radcliffe, and Hillingdon Confederation. And we also have adopted the hub and spoke model in this site, where a lot of primary care are the spoke sites into the study, which are going to support with the database searches and help us identify the right population. So I'm very happy to say that we've partnered with Optum on this, who's going to help us find the right patients for this study. Thank you.
Brill, thank you so much, Priya. And yeah, I think something we've definitely learned in the last few weeks when we've been designing this search here is, like I say, it's quite a hard population to find, and this is why hopefully the primary care element will be suitable for this. Just to let sites know as well, around those questions for exasperation in there, again, something inherently quite hard for us to find. So we've also included in our patient journey from recruit some questions which the patients will be answering around their exasperations as well. So yes, we really hope you can take part with this one and follow up on that. So yeah, I think a bit of a call for action here. Please go in and activate and get in touch here. As we said, there's also a nice little carrot on top of the cake here, where we've got our monthly prize draw. So all those practices that go on to activate will be entered into our prize draw to win an espresso machine. So brilliant opportunity for the practices there. And yeah, we will be sending out some communications when the study goes live, and we hope that your practices will be able to activate and start inviting patients as soon as possible. If there's any questions in the meantime, please do get in touch. The team here are more than happy to support you with either having to activate or anything you have around the research study itself, and we can do that for you. I'll just check if there's anything in the Q&A. I think we do. If not, thank you so much for joining. We will be sending around communications very shortly with details around the study, all the information around how to activate and sign up to recruit, and as well about that opportunity with the Nespresso machine. So brilliant. Thank you very much, everyone. Thank you. Goodbye.